Good day, Ma'am Sabas, and to my fellow groupmates. I am Hanami Jongay, a student nurse from BSN 1B. And today I am going to demonstrate the proper way of assessing the musculoskeletal system. But before that, let me define the assessment of the musculoskeletal system and cite its purpose. Okay, so musculoskeletal system assessment is a thorough examination that should include inspection, palpation of soft tissues surrounding the joint of the interest, and assessment of both muscle strength and flexibility. First, a gait should be observed, and there may be an antalgic gait or a slow gait pattern because of the pain in the specific joint. And the purpose of the musculoskeletal system is it helps to identify the functional anatomy associated with clinical conditions, thereby differentiating the underlying system involved and could correctly point towards the condition, helping in early diagnosis and intervention. Good morning, ma'am. I am Hanami Jongay. I am one of the students of Southern Luzon State University. And today, I am here to assess your musculoskeletal system. And in assessing the musculoskeletal system, it will help the nurses as well as the attending physician to know or to properly diagnose if there is any underlying health condition that needs to be focused on. So I've already done with hand washing, and I already wear my gloves, so we don't have to worry about anything in the personal preparation. Okay, now ma'am, so we'll be proceeding in the actual procedure. So for the first procedure, I will be inspecting or observing the gait for base, weight bearing stability, the fit position, the stride, the arm swing, as well as the posture. So now I will be instructing the client to walk towards me and away from me. So now ma'am, can you stand up? Okay, we'll just put it here. So what you are going to do is you will walk right here and you will go back right in this position. Okay. So now ma'am, walk towards there. Okay. Go back. Okay. So for the next procedure, we will be inspecting and palpating the temporomandibular joint. We will be inspecting and palpating as well as testing the range of motion. Okay, so now ma'am, sit here. Okay. So now ma'am, I am going to inspect and palpate your temporomandibular joint. I am going to touch you, ma'am. Is that okay with you? Okay ma'am, I am going to start now. Okay. Open your mouth. Close. Open. Close. Okay, ma'am, I want you to move your jaw side by side, okay? Side. Another one. Okay. And now, ma'am, I want you to clench your teeth. Okay. One more. Okay. And for the last one, I am going to ask you to move your jaw forward, backwards, forward, backwards. Okay. So now, for the next part, I am going to inspect and palpate the sternoclavicular joint. So I am going to inspect and palpate for me the location for color, swelling, and as well as the masses. Okay, ma'am, I am going to inspect and palpate again. I am going to touch you again. Is that okay with you, ma'am? Okay, I'm going to start now. Okay, just relax. Okay. So, upon inspecting and palpating, the midline location is normal, and as well as the color is symmetric to the color of the body. And upon palpating, I don't touch or I don't palpate any swelling and any masses. And now I am going to inspect and palpate the spine, the cervical, thoracic, and as well as the lumbar spine for pain and tenderness. So, ma'am, I am going to instruct you to stand. Okay. And then, so now we will be proceeding and testing the range of motion of the cervical spine. Okay, so now mama, what you are going to do is you will do the chin to chest and chin to ceiling test. Okay, so now mama, move your chin to your chest. Okay, chin to the ceiling. Okay, and then now for the lateral bending, move your ears to your shoulder, ma'am, just like this. Okay, next one. Okay, and now I am going to evaluate for the rotation. So now, ma'am, I am going to instruct you to rotate your head. Okay, to the other side. Okay, and then move your head to the right side, and then to the left side. Okay. So now, I am going to test the range of motion of the lumbar spine. So now, mama, move over here. Okay. So I am going to instruct you to touch your toes. Touch your toes. Okay. And then stand up, ma'am. Okay. And then sit here. So I will be testing the range of motion of the lumbar spine. So now, ma'am, I'll do the lateral bending. Move your head to the side, the other side. Okay. Now, ma'am, move backward. Okay. Then do the lateral bending again. Okay. Okay. And then now we will be going to proceed for the shoulder, arms, and elbow. I am going to inspect and palpate the shoulders and the arms. Okay now, ma'am, I am going to touch you again. Is it okay with you, ma'am? Okay, I'm going to start now. Okay. So now I am going to proceed in testing the range of motion of the patient. So now, mama, I want you to do the extension and the flexion. So what you're going to do is extend your arms behind, forward, and then do the adduction and the abduction. Arms in the head. Okay. Again, downward. Okay. Another one. Downward. Okay. So now, mama, we will be proceeding in the internal and external range of motion. So I want you to put your hands on the back of your head, and then close your elbow. Open. Close. Okay. So now, mom, after that, put your hands behind your back. Okay, and then turn around. Okay. And And then close, open, close, open. Okay, turn around, ma'am. Okay, so now I am going to proceed in inspecting or assessing the elbow. So what I will going to do is I will inspect for the size, shape, deformities, redness, or swelling in the elbow. So ma'am, in inspecting your elbow, I want you to extend your hands. Okay, then flex. Okay. Going to inspect now. Now, ma'am, put your hands down. Okay, upon inspecting for the size, it is symmetry with each other, and the shape is in a line with each other, and there is no deformities or redness or swelling that is visible in the elbow of the patient. So now I am going to test for the range of motion of the elbow of the patient. Okay, so now, ma'am, what we are going to do is extend your hands. Okay, then flex. And then do the supination. Supination. Okay, and I want you to do the supination and pronation fast. Okay. Okay, now so for the last part, I am going to inspect I am going to assess the wrist. So what I'm going to do is I will inspect the wrist size, shape, symmetry, color, and swelling. Then afterwards, I will palpate for tenderness and nodules. Now, ma'am. I'm going to start now. Okay, so upon inspecting, the wrist size and shape is symmetrical to each other, and the color is also aligned with each other, and there is no swelling at all. And then for the tenderness and nodules, I didn't palpate any of it. So now, ma'am, I am going to perform the squeeze test. So I'm going to touch you again, ma'am. Okay. So, tell me if there is any pain that you feel, okay? Is it painful? Okay, other one. Is it painful? Okay. And now, for the next part, I am going to test the range of motion of the wrist of the client. So now, I am going to test the range of motion of the wrist of the client. So now, ma'am, I want you to follow what I'm going to do, okay? Now, ma'am, so remove this down, okay? And then, ma'am, I want you to hold your wrist and then move sideways. The other one. And now, ma'am, we will be doing the supination and pronation again. Okay. So now, for the last part, we will be instructing the patient or the client to do or to perform the Fallen test. So now, ma'am, we will be doing the Fallen test. What we're going to do is like this, okay? With your wrist downward, and you will do this for 60 seconds, okay? We will start now. Okay, we are done. So now, ma'am, we are done with the assessment of your musculoskeletal system. And overall, I don't see any abnormalities that I don't observe or I don't assess. I've not assessed any abnormalities. So Thank you for your cooperation, ma'am, and you will rest now. And I will be back I will go back tomorrow for the further diagnosis of the attending physician. And what I suggest is I am going to document everything. And rest assured that this will be given to the attending physician for further diagnosis. Okay? So, ma'am, thank you for the day and have a nice day. Thank you.